Okay, so for this one, we are going to do her lateral ligaments and checking for a lateral ankle sprain or fracture. So first, we're going to discuss observation, and there is no swelling, no ecchymosis, and no gross deformity. So we're going to find her ATF, CF, and PTF. So here's her ATF. Her CF is like right here. Her PTF goes down this way. And so we're going to check for fracture by squeezing down. And there's no pain there, so we can rule out a fracture. So we are going to do a heel strike. I'm going to hit your foot. Is there any pain? Nope. So now we can rule out a fracture because there's no pain with the heel strike or the squeeze test. So now I'm going to test her active range of motion and her willingness to move. So, can you go like this? Can you do it again? And then can you go inside and outside? So she's willing to move. And now we are going to test her range of motion with the goniometer. So we're going to test her plantar flexion and dorsiflexion. So we're going to put the stationary arm up her calf, up the parallel to her fibula, and we're going to put the fulcrum at her lateral malleolus, and we're going to have her plantar flex, and I'm going to check, and she is at approximately 152 degrees. And so now we're going to have her dorsiflex, and she is at 125. So her range of motion is about 22 degrees. And now we're going to check inversion and eversion. So we're going to put the fulcrum at the gemma frontalis. The stationary arm is going to go up her tibia, and the moving arm is going to go up her second toe. So we're going to go in, and she is at 165. And then we're going to go out, and she is at 171. Well, 185. So she is 21 degrees. And now we're going to do her anterior drawer and inversion stress tests. So have her sit here, and I'm going to hold her calf and the bottom of her foot, and we're going to invert and evert her ankle. Is there any pain with that? So we can rule out the tearing of her ATF, PTF, and CF. The only possible injuries with this kind of injury are fractures and lateral ankle sprain with possible tear of lateral ligaments. And with all these tests being negative, she does not have a fracture and she does not have a lateral ankle sprain, and there's no tearing of her lateral ligaments.